The foundation, it started that we were strictly equipment. And a couple of years ago we realized that there was more to the health and wellness of our community than just equipment. So we broadened our mandate to include more health and wellness things. We do lots of great programs in the hospital through education, through the equipment, specific to different departments. Donors can allocate their gifts to specific areas, or they can give to the area of greatest need. We also do some work through a gift for the Children's Aid Society, which enables us to give to programs out in the community.
It's an honor to be on a health board, really, because it also gives you that insight to what really goes on in a hospital, how we can get out into the community, encourage them to apply for different things out there to help people. So I think it's sort of a way to give back to your community.
Education adds a whole other dimension to staff recruitment and retention by ensuring that your employees are up to speed on the latest techniques, what's out there in best practices in the community and other communities. It also gives them the feeling of self-worth and knowing that there's somebody behind them and willing to support them in understanding what they do as a job.
Well, I think for us right now, the greatest accomplishment is that our first 2 co-op students have now graduated from nursing programs and are both employed in the Nova Scotia Health Authority. It's the foundation support that allows us to offer this program to whatever student applies, and that we don't have to then have any criteria around what their financial situation might be. So I think it makes it more accessible for all students in our community.
With regard to performance indicators, I think that the main one we look at in our department is basically wait time or access to service. In certain modalities it's more of a struggle just because of the demand, but without the continuing support of the foundation and the ability to maintain our staffing core, we were doing actually very, very well in comparison to other places in the province and in the country. I don't think we would be able to maintain that without that support.
We're really very fortunate. We have a very giving community. Pictou County, whenever asked, they step up to the plate and continue to support. And they support our hospital in many, many ways. Seeing the happiness of a donor and his feeling of satisfaction for giving, being able to show him the impact of his gifts, and hearing from staff how those gifts impact their daily job. It's very rewarding.